Hey everyone, and welcome to the Explainer. Today we're going to break down a really common procedure, umbilical hernia repair. Whether this is something you're looking into for yourself or for someone you care about, just understanding what's going to happen can make the whole thing feel a lot less stressful. So let's dive right in. All right, here's our game plan. We're going to follow the entire patient journey. We'll start with what an umbilical hernia actually is, that belly button bulge. Then we'll check out the three main ways surgeons can fix it. After that, we'll cover what happens before you even get to the operating room, what goes on during the procedure, and finally, what that road to recovery really looks like. Okay, so first things first, what exactly is that bulge we're talking about? Let's get right into the anatomy behind it, and don't worry, we'll keep it simple. So think of your belly button. It's actually a natural weak spot that's been there since you were born. It's where the umbilical cord used to be. A hernia happens when tissue from the inside, maybe some fat or even a bit of intestine, finds that weak spot and pokes through. This opening is called the umbilical ring, and it's part of the linea alba. That's just the band of tissue running right down the middle of your abs. Now, for babies, these are super common, and most of the time, they just close up all on their own. It's usually only if the hernia is still hanging around after age 5 that a doctor might suggest surgery. And the good news? Figuring out if you have one is really straightforward. Usually just a simple physical exam is all it takes. So what happens if it doesn't close on its own, or if one pops up when you're an adult? Well, that's when surgery becomes the go-to solution. But how exactly do surgeons get in there and fix it? Let's take a look at the options. Basically, there are three main ways a surgeon can tackle this. You've got your traditional open surgery, and then you have two minimally invasive approaches, laparoscopic and the even more high-tech robotic surgery. Let's see how they stack up. The biggest difference really comes down to the incisions and the tools. With open surgery, the surgeon makes one single cut right below the belly button to get direct access. But with laparoscopic and robotic surgery, it's a whole different ballgame. They're minimally invasive, which means they use a few tiny little incisions, often hidden right in the belly button, to slide in a camera and special instruments. And of course, different approaches mean different gear. Open surgery uses a pretty standard set of surgical tools, but for the minimally invasive options, you need the high-tech stuff. We're talking about an endoscope, which is basically a tiny camera that lets the surgeon see everything on a big screen, and these special ports called trocars, which are like little gateways for the instruments. Okay, so once you and your surgeon have decided on the approach, what actually happens on the day of the surgery? Let's walk through the prep that happens before that first cut is ever made. It all follows a very careful, predictable routine. You'll be positioned comfortably on your back, and then general anesthesia is given so you're completely asleep and won't feel a thing. Then your whole abdomen is thoroughly cleaned, and finally, sterile drapes are placed all around the area. Every single step is designed to create a perfectly clean and safe environment. And here is a piece of news that is a huge relief for most people. This is usually a same-day procedure. That means you go in, you have the surgery, and you get to go home that very same day. No overnight stay required. All right, now for the main event. Let's take a peek inside the OR and break down what the surgeon is actually doing, step by step. We'll keep it simple and easy to follow. No matter which method the surgeon uses, open, laparoscopic, or robotic, the goals are exactly the same. They have to get into the abdomen, get a good look at the hernia, carefully separate that little sac of tissue, deal with it, and then close everything back up layer by layer. That's the basic roadmap for the whole operation. So, step 1, how do they get in? For an open repair, it's that one direct incision. But for the minimally invasive methods, it starts with a tiny cut for the camera. Then, and this is pretty cool, they inflate the abdomen with a bit of carbon dioxide gas. This creates a dome, almost like a little tent, giving the surgeon a perfect, wide-open view and plenty of room to work safely. Okay. Once they're inside, the goal is to gently free up that hernia sac from all the tissue around it. In an open surgery, the surgeon can see it all directly and uses their hands and tools to separate it. In a laparoscopic or robotic surgery, the surgeon is watching a high-def monitor and using these long, incredibly precise instruments to do that exact same delicate work. Closing everything up is a really meticulous, multi-layer job. First, that inner lining of the abdomen gets stitched shut. Now, if the hole was on the larger side, the surgeon might place a synthetic mesh. Think of it like a patch that reinforces the area to stop the hernia from ever coming back. Then they close up the muscle and skin and pop a small dressing on top. And just like that, the surgery is over. The patient is wheeled into the recovery room. So, what's next? Let's talk about the part everyone really wants to know about. What does recovery actually look like? Recovery is usually surprisingly quick. After you're monitored for a little while, most people head home the very same day. Kids are often back to their usual selves, running around in just 2 to 4 weeks. For adults, it's typically about 4 to 6 weeks before you're back to all your normal activities. And one of the biggest reasons the recovery is so smooth is because this is what's known as a Class I clean surgery. That's the highest possible rating for sterility. All it really means for you is that the risk of getting an infection after the surgery is incredibly low. Now, of course, with any surgery, there are some potential risks. They're not common for this procedure, but it's important to know about them. They include things like the hernia coming back, some bleeding, or a surgical site infection. But, and this is a really big but, let's put those risks into perspective. The prognosis for the surgery is excellent. For the vast majority of patients who don't have complications, they are heading home the very same day, on a clear and fast track to getting back to their lives. So, if you want the bottom line, it's this number right here. In just 2 to 6 weeks, most people are fully recovered and back on their feet. It is a highly effective procedure with a very predictable and relatively quick turnaround time. So, to wrap this all up, umbilical hernia repair, no matter how it's done, is a common, well-understood, and really successful surgery. It fixes a simple problem with a clear, safe process that gets people back to their normal lives pretty darn fast. And that leaves us with one last thing to think about. We talked about those high-tech robotic options. As that technology gets better, cheaper, and more common, you have to wonder, will it eventually become the standard way to do even the most straightforward procedures, just like this one? That's definitely something to watch. Thanks for joining us on The Explainer.